Good morning, ma'am. I'm Nurse Louie. May I ask your name and your age po?
Jenny Guzman, 15 years old po.
So, I'm going to assess you in the neurological, musculoskeletal, and peripheral vascular. Do you have any question, ma'am?
Nothing po, ma'am.
So, we're going to close the curtain and the door for the privacy of our patient. So, we're going to begin with the survey of patient overall hygiene and physical appearance. So, we're going to assess the patient's mental status. Who is your mother and father, ma'am?
Yusminda Guzman and Vicente Guzman Jr.
What time is it?
7:49.
Where are you right now po?
At our house.
I hope you will not get offended, ma'am. I'm just going to evaluate your level of consciousness. Why are you here po?
I'm here for my checkup.
Okay. What did you remember when you are a kid po?
When I play majorette at a competition and then I accidentally dropped my bottle.
What did you eat this morning po?
Mongo and rice.
Can you explain the proverb, birds of feather flocks together?
Those with similar interests or same kind tend to form groups.
Can you please describe to me the word that written on the paper?
Ugly. For me, ugly is not can be only seen at the outer face or outer appearance. It's also in your attitude. Kasi kahit gaano ka kaganda, kung pangit yung ugali mo, wala lang din.
Okay, that's a wonderful answer, ma'am. Can you please close your eyes? Occlude your one nostril. Please identify this substance that I'm going to put at your nose.
Perfume.
You can remove now your one hand. Occlude your other nostril.
Alcohol.
Okay, that's good. You can now remove your hand to your nose, open your eyes, and then we're going to test your visual acuity and pupillary constriction. Please read that chart.
EFPTOZLPED.
And then put your right hand to your right eye. Read the chart.
EFPTOZLPED.
And then you can remove your right hand to your right eye. Put your left hand to your left eye. Read the chart.
EFPTOZLPED.
You can now remove your hand to your eye. I'm going to test your pupillary constriction. Can you please follow my pen light? Okay, can you please smile for me? Frown, wrinkle your forehead, and then puff your cheeks. Okay, so we're going to test your hearing. Can you hear me?
Yes.
Can you hear me?
Yes.
Now, can you please open your mouth for me? Okay. Can you please shrug your shoulder while I'm putting my hand? Okay. Now, can you turn your face at the right and try to push your face? Okay. At the other side. And then, can you please touch your chin to your chest and to each shoulder? And then, put your ear to your shoulder. Okay, to the other shoulder. And then, tip back your head. Okay. So, you can put your head in a normal position. I'm going to inspect the upper extremities. Okay, the color is normal. There is no presence of lesions and rashes. The muscle mass is normal. So now I'm going to palpate the skin for temperature, texture, and any presence of masses. And then now, can you please extend your arm forward and then rapidly turn your palm up and down. And then, can you extend your arm up? And then I'm going to resist your strength. Then I'm going to inspect and palpate the finger and the hand. Can you please remove your watch? I'm going to inspect and palpate your wrist and then your elbow. Then I'm going to palpate the radial and the brachial bicep. And then try to squeeze my two fingers. Okay, so can you please close your eyes? Try to identify what I'm going to write at your palm, okay?
3, 5.
Okay, that's good. And then I'm going to put some things at your hand. Can you identify it?
Okay. Bottle.
Okay. How about this?
Pen.
Okay, that's good. Can you please lay down in a supine position? I'm going to inspect the lower extremities. I'm going to inspect the legs and the feet color, lesions, varicositis, hair growth, nail growth, edema, and muscle mass. Okay. I'm going to test for pitting edema in the pertibial area by pressing finger in the skin of the pertibial area. So I'm going to palpate for pulse and skin temperature at the posterior tibial. And then the dorsalis pedis. And then the popliteal area. So my patient will perform the straight leg test with one leg at a time. Can you please move your leg laterally with the knees straight to test the abduction and medially to the test abduction of the hips? On the other leg. Can you please raise your thigh po? Push outward against my resistance. Okay. And then push backward. Okay. The other. So next we're going to assess the patient deep tendon reflex using the hammer reflex. So we're going to first assess the wrist. And then the antecubital area. The tricep tendon. And then the Achilles tendon area. Can you raise your leg po? The other one. Okay. Next, we're going to stroke the sole of the patient foot with the end of the hammer. Then the other. Can you please dorsiflex and then plantar flex both feet against opposing resistance? Can we go outside po?
Okay po.
And then we're going to observe the patient walk in regular gait. In the toe. On the heel. Heel and toe. Okay. So my patient will going to perform Romberg test. Can you stand straight, close your eyes, and then put your hand at the side? So I'm going to observe if my patient will going to sway or maintain her balance. And then we're going to perform hand hygiene.